Let's be honest, modern medicine is broken. Patients are dismissed, doctors are exhausted, and mental health care is decades behind where it should be. So people turn to wellness, and I get it. They're searching for something more human and more hopeful. But too often they end up with advice that sounds good and falls apart when it really matters. I'm Dr. Georgie Nanos, a board-certified family physician, and I believe we can do better. We can combine the best of real science and real compassion and create a system that actually helps people heal. This is The Kind Revolution, a podcast about what's broken, what's possible, and how to finally feel better in your body, your brain, and your life. Let's change medicine from the inside out.
Welcome, everyone. Today we're diving into something really important, something that impacts so many families, TMS, or Transcranial Magnetic Stimulation, but specifically for children.
Yeah, it's a big topic. And we know parents often feel, well, pretty helpless when their child is struggling with anxiety or maybe focus, regulating emotions, even early depression signs.
Absolutely. You want the best, but sometimes, therapy feels slow. And the idea of medications and their side effects, that's tough for any parent to weigh up.
It really is.
So today we're exploring a different angle based on the research. We're looking at TMS for kids, sometimes as young as 6, not as a last resort, but maybe, just maybe, as a safe first-line thought for behavioral concerns.
Right. A non-invasive way to potentially help reset things.
Exactly. Let's see what the science actually says about this.
Okay, so TMS itself, Transcranial Magnetic Stimulation.
Yeah.
It's FDA approved, fundamentally non-invasive. It uses these focused magnetic pulses. Think of them as gentle signals.
Gentle signals to do what exactly?
Well, they activate and sort of reset specific brain circuits, the ones that handle mood, focus, emotional regulation, basically helping the brain find its balance again.
Okay, and we mostly hear about this for adults with depression, right? But you're saying the picture is getting broader.
Definitely. While the FDA clearance for depression is technically for adolescents 15 and up, there's a growing body of research looking at younger kids, and it suggests TMS can be safe and, importantly, effective for them too.
Safe is the key word there for parents. What does the safety data show?
Well, the studies consistently show no serious adverse events in children. That's a really significant finding when you're considering any intervention for a child.
No serious events. That's huge. You mentioned it's non-invasive, but what are the other core benefits for this age group?
Big ones are that it doesn't sedate the child. They're not groggy. It doesn't alter their consciousness. And crucially, no medication is required for the TMS itself.
So they're awake, alert.
Completely. They can usually go right back to their day, school, whatever activities they have, straight after a session. It's like retraining the brain from the inside, but without those systemic effects you sometimes get with meds.
Okay, let's dig deeper into that safety profile then. Because brain stimulation, even gentle sounds, well, it makes you pause as a parent, right? What did the reviews find?
There's a pretty comprehensive review recently looked at 51 different pediatric studies. This covered TMS and also a related technique, TDCS, across various ages.
And the takeaway?
Really consistent findings. The effects were overwhelmingly minor and temporary. Things like maybe a little scalp tingling where the device rests, or sometimes a brief headache, things that pass quickly.
Okay, mild and transient. That sounds manageable.
Yeah.
Was there specific data for the younger kids, say under 10?
Yes. There were studies included that focused specifically on children aged 6 to 10, often looking at ADHD symptoms.
Same result.
Pretty much. They saw improvements in ADHD symptoms, and the side effects reported were just those same mild transient ones. Mild headache, maybe some tingling, nothing major.
So it seems like compared to other options, TMS stacks up pretty well on the safety front.
You could definitely argue that. When it's used carefully under medical guidance, it's considered one of the safest neurostimulation methods out there. Arguably, maybe even safer than some common medications.
That really does shift the perspective, doesn't it? Which leads us to the idea of using it early. Why intervene early with something like TMS?
The big reason is brain plasticity. A child's brain is incredibly adaptable, much more so than an adult brain.
Like more flexible.
Exactly. The neural circuits, the pathways, they're still being actively shaped. So you have this window where you can potentially recalibrate these circuits more easily before patterns get really locked in.
It's like trying to guide a young plant versus trying to bend a thick branch on an old tree.
That's a perfect analogy. Gently guiding that growth early on can be much more effective.
So intervening early with TMS might mean less need for medication down the line, avoiding those side effects we talked about.
That's the potential, yes. It could contribute to building resilience long term. It's more of a proactive approach to wellness, rather than just reacting when problems become severe.
Which challenges that old model of waiting for kids to, fail other treatments first.
Right. The idea here is introducing a supportive, science-backed tool earlier, alongside therapy, alongside family support. It's about building a strong foundation, not just patching things up later.
Okay, let's talk evidence then. What does the research show for specific issues like ADHD in kids?
For ADHD, there have been meta-analyses, those studies that combine results from lots of other studies.
Right, giving a bigger picture.
Exactly. One looked at 8 studies with over 300 children combined, and it found significant reductions in both inattention and hyperactivity after about 3 to 6 weeks of RTMS, which is repetitive TMS.
Significant reductions. That's promising. What about depression and anxiety in kids and teens?
Well, the FDA clearance for depression, as we said, is 15 to 21. In those trials, they saw nearly 78% improvement, which is substantial.
Wow.
But there was also a smaller pilot trial looking at kids from 13 to 21. It found a 56% response rate, meaning symptoms got significantly better, and 44% went into remission. And again, no serious side effects.
So even below that official age cutoff, the early signs are positive.
They are. And it's why clinicians are starting to consider it carefully for younger patients based on this emerging data. It helps to understand how it works in the brain.
Okay, so how does it work? What part of the brain is it targeting?
Most often, the target is an area called the left dorsolateral prefrontal cortex, the DLPFC.
The DLPFC, what does that part do?
Think of it as the brain's executive control center, or maybe the emotional regulation hub. It manages mood, motivation, how we react emotionally, decision-making.
Okay, so pretty crucial stuff.
Absolutely. And in conditions like depression and anxiety, this DLPFC area often seems to be underactive.
So TMS wakes it up.
In a way, yes. The magnetic pulses gently stimulate that area, reactivating those circuits, strengthening the connections. It helps restore balance, helping those brain cells communicate more effectively again.
Like a nudge back towards normal function.
That's a good way to put it. A gentle reset for those communication pathways.
All right, that makes sense. Now, practically speaking, what's a treatment day like for a child? Is it scary? Long?
That's a really important question for parents. The descriptions make it sound quite kid-friendly, actually. The sessions themselves, especially using the newer ITBS protocol,
ITBS.
intermittent theta burst stimulation, it allows for much shorter sessions. We're talking maybe just 3 or 4 minutes of actual stimulation.
3 or 4 minutes, that's it.
Often, yes. And they use simple things to make kids comfortable, maybe an ice pack on the head beforehand, calming music, something quiet to look at. Keep it relaxed.
Okay. And the actual procedure. What happens when they sit down?
It's pretty straightforward. The child sits comfortably, usually in a chair like a dentist chair. They measure the head carefully to find the exact spot. They get earplugs because the machine makes a clicking noise.
Oh, wow.
Then the coil, which delivers the pulses, is positioned gently against the scalp. Before the main treatment, they do a quick mapping.
Mapping?
Yeah, it's called motor threshold mapping. They place the coil over the part of the brain controlling hand movement and give single pulses until they see a tiny twitch in the hand, usually the thumb.
Why do they do that?
It personalizes the treatment intensity. Everyone's threshold is slightly different, so this finds the exact right energy level for that specific child. It ensures it's effective, but still gentle.
Got it. So it's tailored. Then what?
Once they have that threshold, they move the coil to the target spot, like the DLPFC we talked about. The machine delivers pulses in short bursts with pauses in between.
What does the child feel?
They feel a tapping sensation on their scalp. People often describe it like a woodpecker tapping, or maybe someone drumming lightly with a finger. It's noticeable, but not painful, and they hear the clicking sound.
But no pain, no fuzziness afterwards?
Correct. No pain, no sedation needed, no mental fog. That's a huge plus. Many kids can literally get up and go back to school or play right after.
That quick.
That quick. Sometimes there might be mild soreness on the scalp where the coil was, or that transient headache we mentioned, but it usually fades very quickly. Low impact on their day.
That's incredibly reassuring to hear. So let's talk about how this fits into the bigger picture. Personalized care, integrating it holistically.
Absolutely. Because it's not just about the TMS sessions in isolation. The protocols themselves are flexible. We mentioned the quick ITBS, common for kids.
Right, the 4-minute one.
Yeah. But longer, traditional RTMS sessions were also an option, if needed for a specific case. The point is, The treatment plan is tailored to the individual child's needs.
So who makes a good candidate for this? When should families maybe think about exploring TMS?
Generally, it's considered for children whose emotional or behavioral challenges seem more significant than typical for their age. Or maybe kids who are still struggling despite being in therapy.
Or perhaps families who really want to avoid or delay medications.
Exactly. If there are concerns about medication side effects, TMS presents a non-medication alternative worth discussing.
And how does it work alongside other support, like therapy? Does it replace it?
No, not at all.
Yeah.
The ideal approach is very collaborative. TMS works best when it's integrated into a holistic plan.
Meaning
Close work between the family, the TMS clinician, the child's therapist or counselor, maybe their pediatrician too. It's about combining TMS with ongoing therapy, family support, maybe school interventions if needed, a whole support system.
building that full picture of care. So is TMS a quick fix, or are we looking at more lasting changes?
It's definitely not positioned as a quick fix. Remember that plasticity idea. TMS is more like brain training. It's cumulative. Yes. The repeated sessions gradually help rewire those circuits, strengthen the connections involved in thought and emotion. Over a full course of treatment, the aim is lasting improvement.
Improvements like?
Better emotional regulation, maybe more energy, clearer thinking, because you're fundamentally helping the brain circuits function better. These improvements can often last months, even years.
Like physical therapy, but for the brain's wiring.
That's a good analogy.
Yeah.
And potentially faster results than traditional therapy alone for some issues.
What about follow-up? How do families know the progress is sticking?
Good question. The programs usually involve quite comprehensive follow-up, often daily check-ins right after the main treatment phase ends, say for the first week.
Daily, okay.
They may be weekly check-ins for about a month, and then periodic check-ins further out, like at 3 months, 6 months, 9 months, a year.
Why so much follow-up?
It's to monitor progress, make sure the gains are holding, provide ongoing support, and adjust anything if needed. It ensures that sustained well-being is the goal, not just finishing the sessions.
Okay. As we wrap up our conversation today, it really does feel like TMS offers a potentially hopeful, empowering path for some families.
I think that's the core message. It provides another option, one grounded in science, that could be the supportive reset a child needs to really thrive, especially if families feel they've hit a wall with other approaches.
It's about transparency, using the evidence, and having a plan focused on safety and ultimately hope.
Exactly. Compassion and hope are key.
So if you're listening, maybe you're a parent, and this resonates, thinking maybe this could help your child, perhaps intervening earlier, it seems worth exploring further.
Absolutely. Reaching out, getting more information based on your child's specific situation is a great next step.
And it leaves us with a thought to consider, doesn't it?
It does. In this age where we have access to so much information, so many choices, what does it really mean to proactively seek out these kinds of science-backed solutions for our kids' developing brains?
Yeah, could exploring something like TMS early on not just manage current struggles, but actually help prevent challenges from getting bigger down the road?
Could it help build that foundation for lifelong resilience, for well-being? That's a powerful question for all of us to think about as we consider the future for our children.
Thanks for listening to The Kind Revolution. Around here, we're not just talking about treatments, we're talking about change. The kind that challenges the way medicine's always been done and makes room for care that actually works. If something in this episode resonated with you, if you learned something, questioned something, or just felt seen, take a second to share it, please. Leave a review and join the conversation. Because this isn't just a podcast, this is a movement. And you're part of the revolution now. This is The Kind Revolution.